past the hour of 7 o'clock. I'm glad you're still with us here on Morning at NTV. Time now for the Kickstarter discussion, and we are going to look into the repercussions that are being felt across the globe in light of the ascendancy to the presidency of Donald Trump in the United States of America. In the hours after his inauguration, executive order after executive order were outed, and one of them was the sweeping review of aid to countries across the globe. What we do know that the United States is responsible for a staggering $72 billion in aid that is disbursed to countries across the globe. For the next 90 days after his inauguration, a review is being conducted, after which halts or realignments will be done in line with aid. Now, for Uganda, the health sector is one that depends heavily on donor funds, and the United States being a top donor means that so much could change if realignment on our side is not achieved as much as possible. With me in the studio, I have Dr. Judith Nalukwago. She's a health worker, a dental surgeon to be specific, with the health services franchise C-Care. Many thanks for joining us. We also have John Paul Kafuko. You're a program manager at the Youth for Tax Justice Network. Many thanks for joining us.
Thank you. Good morning.
We expect later to be joined by Dr. Shamim Nambasa, who is also a health worker, for perspective on this and also a range of other issues as things are happening within the country and of course across the globe. But let me first engage Dr. Nalukwago on what came to your mind when it became clear that the tranche of funds that are channeled to Uganda in terms of aid, grants, loans towards the health sector were all of a sudden going to come to either a halt or a review that would significantly affect how the rollout is within the country. How did you receive this news?
Thank you so much. Like he said, Dr. Nalukwago Judith. I work with C-Care, and I also belong to NUP, my political party. Today, yeah, we young people are championing change in our country. When that came to effect, when there was an executive order by Donald Trump, President Donald Trump, the president of USA, of course, as health workers in Uganda, especially those who work for implementing partners of PEPFAR, this came as sad news because of some of the things that PEPFAR and USAID have been doing for this country as far as pushing the health sector forward. Of course, we have to first look at what has PEPFAR been doing, what has this donor money for HIV and other related tuberculosis and all these other things related to that field, what have they been doing and how have they been serving Ugandans? That is what we have to first see, that we know the impact. First of all, this aid, we've been getting it in the health sector. It's through PEPFAR, USAID, and CDC. And they're implementing partners in Uganda. We have TASO, we have IDI, we also have, I think, Baylor. Those are the implementing partners in the country. So at the moment, first of all, they provide employment opportunities for Ugandans. All of you know that we have so many doctors in the country, and many of them actually are home, especially the ones of my age, because they don't have employment opportunities. So when you have these big employers pulling out or pulling funding from the country, it affects especially us, the young people, because we are getting a lot of employment, let me call them gigs, through the services that they provide to Ugandans. So actually, they employ over 20,000 Ugandans through their projects that they carry out in the country. So you can imagine 20,000 people losing jobs because donor money has been pulled out. And then on top of employment, they also provide these other services which include HIV screening, medication treatment, counseling, counseling for gender-based violence, etc. So over 1.4 million Ugandans benefit from HIV treatment, counseling, and etc. from these implementing partners of PEPFAR through this donor money. So you can imagine that every single day, 14,000 Ugandans are going to lose access to HIV drugs if these people pull out like they had promised to. Though I saw yesterday night the president rescinded with, of course, conditions for that rescinding. So,
yeah. In fact, I was about to say it's been described as a waiver that should be able to allow for humanitarian and health groups to continue work. Does that offer much needed respite? Yeah,
surely it gives us some time, but still we as Ugandans need to prepare. The government needs to prepare. What if these people pull out completely? What do we do? Are we going to allow 20,000 Ugandans to lose their jobs? Are we going to allow 14,000 Ugandans not to get HIV medication every single day, including of which 7,000 are children? So those are the things the government has to look into, that how do we move forward from this scare from the president pulling out donor money from this sector. Even when it has been rescinded, there have been put conditions towards it. They do not allow, if that organization supports abortion, even if using that donor money or using donor money from another country, it was clear that they're not entitled to this money. So you can imagine, if you've been supporting abortion, you're not going to get this money anymore. Wow. So those conditions are going to be stringent on the Ugandans, and it's the local person down there who suffers, because these are the people who receive HIV drugs.
That's right.
You know, activities in the different centers have been stopped. You know, PEPFAR has been delivering HIV drugs direct to the people. But now, since activities have been stopped, they told them that people have to come and receive their drugs. You know the stigma that causes.
The stigma, the infrastructural impediment, and the inability for somebody to get to. That's interesting. Of course, we shall be going into the nitty-gritty of that and see how best these particular interventions can be maintained. But allow me engage Mr. Kafko. You are from the Youth for Tax Justice Network. This whole thing comes down to, at the end of it all, the taxpayer and the amount of money that government can galvanize in order to close the gaps that may appear on account of the freeze in funding. Before we even get into the nitty-gritty of the tax aspects and how much revenue we can garner very quickly to be able to meet this particular challenge, what's your take on this development?
Thank you very much, and a good morning to everyone watching today. I'm very glad to be here. My take on these orders is something we've been speaking about since the time COVID-19 broke out.
That's right.
If you remember, there was the pandemic which came in, and every country was prioritizing their own people. You know, aid wasn't flowing as it used to be. It was as always. So for me, with these executive orders, it just brings to mind that time when the COVID-19 pandemic came through, and then we were looking for vaccines. You couldn't get the vaccines anywhere. Everyone was trying to save their own people, and you know, our health sector was just in shambles. So for me, this just brings to light what we should be doing, trying to ensure that we are self-reliant as a country. We are able to cater for our health sector. We are able to fill these gaps that are being covered by the USA, and also, most importantly, how are we mobilizing enough resources to be able? How are we mobilizing the money to be able to fill this gap? And to me, I think some of the things we've been speaking about is cutting down on the public expenditure, especially wasteful expenditure in government. And I think I was reading the Auditor General's report recently, and he was pointing out quite a number of areas. For example, he was speaking about gold exports last year, the year ending 2024. I think it was over $3 billion of it, which left the country without proper permits and even paying the taxes, you know. So that is money we are losing. I think last year also, the IGG had a report saying that Uganda is losing over 10 trillion in corruption. And I think she also went ahead and said that the money recovered out of this was only 2.3 billion, around there. So you can imagine, we are saying that we are losing a lot of money, but we're having these challenges here. We need as much resources to cover up in the health sector, even other sectors, education, social protection, and all that. So because USAID has been covering a lot of these, education, health, and so many other sectors. So for me, it has always been, how are we cutting down on public expenditure? How are we closing these loopholes through which we are losing a lot of resources, which could be diverted to these critical sectors which are being funded by these donors.
Allow me to stay with you on that, because many times when interventions or policy changes do happen that affect a certain section of people, we tend to look to the technocrats, we tend to look to the planners for solutions, but we also have experiences with these technocrats and the planners that it won't be that they are going to sit down and feel the urgency of the matter, not at all. And that is down to what you've just said, that corruption is rampant and that most of the funds maybe that are stolen, if they weren't stolen, would go to covering such challenges. How does the government move right now? I know as civil society, you often have so many beautiful blueprints that government could take on. How effectively does government move right now within the workings of the budget framework paper to counter this earthquake or shock, so to speak?
Okay, I think the most usually what government does in times of sometimes they call them emergency situations, or maybe disaster strike or something. Usually they do supplementary budgets.
Supplementary budgets,
yes, to try and cover up the gap. And I think it wouldn't be far-fetched to take that line. Though of course recently there's a supplementary budget which was termed classified, which was recently passed.
Those are the experiences I talked about.
I don't know where that went, but it would be, because you see, when you look at from a perspective of these people who plan, supplementaries should only come in situations which are not planned for, which
that is right.
Emergency situations basically, you get it. So they should be restricted to that only. And I think this executive order is something probably we didn't anticipate. For me, to an extent, I did, because the last time Trump was president, I remember he pulled US out of the WHO, you know,
and the Paris Agreement.
Paris Agreement.
We saw this
I
coming.
think some of these things here were really expected, and perhaps, and I think it was also very high likely that he was going to win the election. I don't know, maybe our planners thought differently, but for me, I think some of
our leaders slept on the job.
Perhaps,
as a moderator, I'm very blunt about it. You might not want to be, but our leaders slept on the job. Okay, that's interesting. Let me return to Dr. Nalukwago, and there is a lot of confusion when you look at the waiver versus the order for realignment, especially one that allows for 90 days. Have you read the waiver as released by Secretary Rubio? And you can break it down for us, what he exactly means when he says, for example, health and humanitarian groups, that many are still uncertain, but there is an aspect of gender, diversity, transgender, and non-life-saving work. I do not know whether Trump's stance rather on the fact that recognition is for two genders, male and female, will have. I don't know how that is going to morph into this, because at the end of the day, we were on the wrong side of Washington and other capitals on account of the Anti-Homosexuality Act. Now here we are, on the right Washington, we are on the right side. How is this going to play out?
Of course, like when they rescinded the order came with those that these and these and these have to align with our policies as USA for us to be able to give you that donor money.
That's right.
And of course, their emphasis was on humanitarian aid, especially in the health workforce, because these people, this field deals with people's lives.
That's right.
So that means, this work that these implementing partners have been doing is going to continue, but with conditions of day, like diversity, equity, and inclusion have been put aside. That is not going to be our priority moving forward, because even the USA policy, you saw the executive orders he gave, day has been put aside. Things like homosexuality, also, if you support homosexuality, you're not entitled to receiving this funding. If you support abortion.
It's amazing how the world can change in a space of a few months.
Yes, and you see, when the president of USA came, when they were voting with Donald Trump, he promised them that what he's going to do for their country is saving money for the citizens.
Money for the citizens.
Yes, they have been spending a lot of money through donations and all that. Now they're going to cut cost, and those are the things we need in our country: cutting cost and prioritizing where it is needed. Like he said, we are losing 10 trillion shillings every single year. but you know our health budget is 1.4 trillion. Now imagine if you are losing 10, can't we, how much can we do if our budget at the current is 1.4 trillion? You understand? So the order is simple as people who support abortion, implementing factors, partners that support homosexuality day, all of them will not benefit from this funding. Yes. Wow,
that is an interesting one. Now, for the tax justice campaigner, there is a lot that is going to happen in terms of prioritization on our own part in light of this challenge. I do not know whether there are groups that are quickly identifiable as the ones that will be affected adversely, away from those that are receiving, for example, critical treatments of ARVs and stuff like that. There are LGBT and all those other sections of our society, but there is the guy who is neither affected by HIV/AIDS or within the LGBT community and simply struggling in the villages to be able to survive. No one is looking at them, but these are the majority of Ugandans who need these interventions in terms of what health centers are able to provide. If somebody wants something as simple as a Panadol tab, I don't know how it's going to work out. Have you had an opportunity to discuss at the level of economists, for example, on how best it's going to roll out?
Yeah, I think these executive orders go beyond the health sector, and I think that's what I was speaking about earlier. It spreads across education, it spreads across social protection, because USAID has been supporting these sectors in our country. So when you talk about the young person at the grassroots, it spreads across, of course. I mean, from the education, from the health sector, social protection. That means their lives are going to be in shambles. And for us, we've been discussing this, not even just now, but from way back. You know, what happens if we no longer have this aid, we no longer have this support? What's going to happen to our people? You know, the situation is already dire. I was still reading again the Auditor General's report. We already, for example, our education sector, and I think speaking this after the PLE results, I remember saying that the teacher student ratio is supposed to be about 1.1 to 53. One teacher for 53
learners.
But it's about 1 to 75, which is already below standard. And this, of course, affects the way these learners are performing, and it all goes back even to the females. I was saying when it comes to menstrual hygiene and their health management, many of them, I think the Auditor General quoted about 64% of girls were leaving school or were missing school.
That is right.
Because of menstrual health issues, you know, because they're not providing kits, they're not providing these pads and all that, and all this goes back to there's insufficient funding. Funding. We are not investing as much money in some of these sectors, which is affecting the young girls, especially in the UPE system. You know, so for me, it has always been there, and this is a report from last year. That was before the orders, the executive orders. So we've always been having some of these challenges, particularly about the health sector. I was saying health equipment, especially that we have. I think it was about 3 billion. Budgeted to maintain health equipment, scanners and all that. But I think it was only 1 billion that was budgeted to cater for this cost, you know. So you are going to have health equipment which is going to maybe get spoiled, and you know, it's no longer serving the people. Then you also have the issue of health workers, they're not paid well, and it all goes back to the money. And at the end of the day, as you say, the person at the grassroots is the one who is suffering. So it all goes back to prioritizing as government. Where should we be putting this money?
That is right.
Yeah, so.
Okay, thank you very much, Dr. Nalukwago and Mr. John Paul Kafuko. Allow me welcome Madam President, Dr. Shamim Nambasa, to Morning at NTV.
Thank you so much.
We are talking and trying to level up and see what can be done in light of what is no doubt a groundbreaking challenge that the Trump administration has occasioned upon countries like Uganda. The complexities of aid put aside, the lives of millions of Ugandans who've been benefiting from these programs that are directly funded by the United States being the biggest donor across the globe. Something we have to look at. First and foremost, what's your take on that development before we can even delve into how, from your perspective, things ought to work?
Hello, good morning, everyone. Thank you so much for having me. I'm Dr. Shamim Nyambasa, a pharmacist by profession and a member of the National Unity Platform, and I consider myself the Minister of Health of the Kyagulanyi government. And I'm very glad to be here. And first and foremost, I would say that my take, there have been quite a number of directives that the Trump administration did come out with. But what affects us most is the reduction or the freeze on the USAID that we have been receiving. And I think for most Ugandans, they may not necessarily understand to what extent this actually is going to affect us or would have affected us, because I hear there has been some rescinding of those executive orders. But we need to recognize that the President's emergency plan for AIDS relief, which is PEPFAR, has been our biggest source or our biggest funder. I mean, that is the most amount of money that we get in as far as AIDS relief is concerned. I know that they have been funding the Infectious Disease Institute, and CDC works together with the IDI, which is the Infectious Disease Institute. So it is not just about AIDS alone. First and foremost, people need to understand that it is about infectious diseases.
Infectious diseases.
Yes, and you know, for infectious diseases, it's any disease that can be spread from one person to another. Yes, and so we look at the amount of money that has been coming through as far as PEPFAR is concerned, and I know that it was launched. I know that USAID and PEPFAR and, you know, everything was launched from as far as 2004 by President Bush. So for all those years, that is close to 21 years, we can say that the Ugandan health sector has been surviving largely on the USAID. And if we are to look at the statistics, for example, I know as far as the Uganda AIDS Commission statistics from 2023, we have approximately 1.5 million Ugandans that are suffering from HIV/AIDS. But then we have over, I think, about 38,000 new infections.
That are living with HIV.
Those that are living with HIV, yes. Thank you. And we have new infections on an annual basis of about 38,000, which then translates to about 3,000 something per month. So then if you put it to a daily basis, that would then become about 100. So as we are speaking right now, we have new infections that are being gotten by Ugandans. So it is to that extent that it goes down to the statistics that we have, to the number of people that we have living with HIV and need to be taken care of. And for me, so then it still now goes back to we the young people between the age of 15 to 24. You find that you have about 15,000 new infections. So these are young people, and also we must appreciate that the USAID has been helping us in as far as human resources concerned. For many people that know, I was in Yumbe for my internship, and I know that for medical officers, IDI was paying some of them to offer services to the common Ugandans. As a hospital that is a government hospital, as a Ugandan population or as the Ugandan government, they're not able to take care of our people, that we must have some sort of aid coming through to offer that extra support. But then also we must then address the hypocrisy that comes with it, that we had medical interns fighting to be deployed, but then we can't afford to put them
that's a question that I'll reserve for later on, as we understand the intricacies that have been occasioned upon us as a country. Ladies and gentlemen, I'm going to have to go for a break. When we return, we shall delve a little bit deeper and further into this, including what partners that haven't halted any aid might be able to do in the realignment. For example, in light of what Washington says, can UK or Paris, for example, increase their own funding, that is to cover the gap? That's a conversation that will be coming up. Stay with us.